This month marks the third anniversary of the Ontario Network of Injured Workers group Workers' Comp is a Right campaign. Injured workers from across the province built this historic campaign to focus our advocacy and to inform politicians, the public, and the WSIB of our demands.
By now, many of the actors we've been trying to reach are aware of our three demands.
End deeming by stopping the practice of pretending injured workers have jobs when they don't.
Stop cutting injured workers' benefits based on so-called pre-existing conditions that never bothered us before our injuries.
And number 3, listen to our family doctors by ending the use of paper doctors.
As we celebrate the third anniversary of the launch of our campaign, we have witnessed some positive changes.
For one, we have won important battles relating to the way the WSIB treats pre-existing conditions when calculating settlements for permanent injuries.
This important legal victory achieves part of our one demand.
We still have to stop the practice of reducing our loss of earnings benefits based on these pre-existing conditions.
Together with our many allies, we have raised the profile of injured workers' issues to the highest level in decades,
leading to hundreds of stories in the media and much greater community knowledge.
Prior to the last election, we hosted an election debate. In the last provincial election, for the first time in recent memory, 2 of the parties included injured workers' issues in their platforms. We continue to work with all parties to ensure these issues will become a standard part of their election platforms moving forward.
In addition, 2 private members' bills now sit before the Ontario Legislature, introduced by the NDP's WSIB and Health and Safety critic Wayne Gates.
The fact the official opposition has a critic dedicated to workers' comp issues is a victory in itself.
One of his private members' bills, Bill 119, would end deeming.
We look forward to continuing to work with MPP Gates to see his bills called to a vote and passed into law. Last year, we raised the issue of deeming to the international stage by bringing forth a complaint to the United Nations,
focusing on the violation of human rights of injured workers with permanent impairments.
This current COVID-19 has underscored how important changes to the WSIB are. This coronavirus is causing a whole new kind of work-acquired illness.
To date, the WSIB has denied over 1,000 workplace-related COVID claims, including 600 that have been filed by workers in the healthcare sector.
While the federal and provincial governments provide improvements to nearly every other social benefit system to provide additional funds to offset the increased costs of living in a pandemic, the WSIB stands alone in refusing to help cover these costs.
In fact, they continue to pretend that thousands and thousands of injured workers have jobs that do not exist, allowing them to continue to cut much-needed benefits.
And even with economic conditions and job losses on par with the Great Depression of the 1920s, WSIB continues to tell injured workers they should be out there working in dangerous jobs that simply don't exist.
We have always said that anyone is one slip and fall away from becoming an injured worker. Now, with COVID-19, you may be one breath away from a possibly fatal work-acquired illness. Workers need to know that the workers' compensation system will be there for them when they get sick and injured.
The system we have now is not adequate. That is why we have fought so hard and will continue to fight even when it seems the deck is stacked against us.
We ask our allies and the general public to continue to work with us. You can join in our fight in several important ways. Continue to send letters to Premier Doug Ford and Labour Minister Monty McNaughton, asking them to support the priorities we developed 3 years ago.
Or sign a petition in support of our demands. And join our mailing list to stay in the loop by visiting tinyurl.com/workerscomplist.
Injured workers have reason to celebrate the achievements of the last 3 years. Many of us didn't get all we needed from the WSIB,
but we fight on for our sons and daughters and for our grandchildren and their kids. Workers' comp must be a right.
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 Because workers' comp is not a privilege, workers' comp must be a right. Thank you.
Join the Ontario Network of Injured Workers groups on Thursday, September 10th at 2 p.m. for a celebration of injured worker resistance. We will look back on the accomplishments of the Workers' Comp is a Right campaign and look ahead at what's next. Thursday, September 10th at 2 p.m. Register online at crowdcast.io/e/wikir3. That's crowdcast.io/e/WCIAR3.